it's Patrik Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated adults and children, including BIPAP and CPAP ventilation, including medically complex patients at home, such as seizure management, including home TPN as well. So in today's video, I want to talk about a case study of ours where we actually provided palliative care at home for a gentleman in his early 70s last year. Now, I'll quickly talk about the gentleman's history and then gentleman's pre-medical history, and then also why he needed intensive care at home services. So he had a long-standing history of cancer. Initially, he was diagnosed with bowel cancer in the early 2000s. He had a colostomy bag for that. Eventually, the bowel cancer spread into the lungs. He had lung metastases. He also had a history of pancreatitis. He had blocked right ear with tinnitus. He had the right side of his diaphragm was paralyzed. He had a total knee replacement. He also had a upper left lobectomy as part of the metastatic lung cancer, and eventually he was BiPAP dependent, initially only overnight, but then as the lung cancer progressed, he was BiPAP dependent 24 hours a day. He also had, as part of his diaphragm paralyzed, he had a phrenic nerve palsy. And as I said, eventually he was BiPAP dependent 24 hours a day. Initially he might have been able to take the BiPAP off for about 5 minutes when he was in the shower, but then as time progressed, we ended up having him in the shower even with BiPAP on, but he was still mobile. The last few weeks he was no longer mobile. We were basically providing palliative care for about 3 or 4 months at home. Last year, the alternative for this man would have been to be in intensive care, with his BiPAP dependency, also oxygen dependency. We had an oxygen concentrator at home to supplement with oxygen when needed. Obviously, the referral was made to us, and I'll just read out, the referral from the specialist: chronic respiratory failure requiring ventilation, life support 24 hours per day, 365 days per year, home care required by intensive care at home with ICU trained nurses, ventilation, mobilization, stomach care, and all nursing care. And also what's important here to understand as well is, we are providing home care according to best practice and evidence-based guidelines. We're providing those care services according to the mechanical home ventilation guidelines that you can read on our website at intensivecareathome.com. The mechanical home ventilation guidelines are evidence-based. Services such as intensive care at home have been around in Europe, particularly in Germany, since the late 1990s, and all the evidence is there that intensive care at home can be provided safely if there are intensive care nurses available 24 hours a day with a minimum of 2 years hospital ICU or pediatric ICU experience, and that's exactly what we are providing at intensive care at home. As a matter of fact, we are employing hundreds of years of intensive care nursing experience in the community. I don't think that any other service provider can match that. Bring so many experienced ICU nurses into the community and basically replicating an ICU bed in the community. And we take pressure off the healthcare system by bringing the intensive care skills into someone's home, keeping intensive care beds empty. So coming back to our case study, obviously the client had the desire not to be readmitted back to ICU. He had the desire to spend whatever time he had left at home. And we enabled that for him and for his wife as well. You know, it was very important for them to have quality time at home. It was very important for them to, you know, spend whatever time they had left in the comfort of their own home. You know, would have been literally a nightmare for both of them to have this gentleman readmitted back to ICU and not have the quality palliative care at home. So we then started a 24-hour, you know, nursing roster at home with our intensive care at home nurses, you know, with our ICU trained nurses, and made sure that this gentleman has all the quality care at home, you know, that he needed to spend his last few months at home in the comfort of his own home with his wife, and, you know, his kids were visiting. And it was a really good experience, you know, for everyone involved. And I do believe by the time he passed, he was very much at peace, you know, and his wife was at peace that, you know, at least he didn't have to go back to hospital, you know. Pain was fairly well controlled. We were working very closely with, you know, local palliative care service here in Melbourne, and making sure that his pain was well controlled, you know, that all of his needs were taken care of. And as unfortunately the cancer progressed, you know, even with the ongoing BIPAP, you know, he could no longer be ventilated appropriately, and then, you know, he passed away eventually. But he passed away with comfort and with dignity, and which is very important. You know, everyone that's worked in ICU, everyone that, God forbid, lost a family member in ICU knows that ICUs are not the right place for end-of-life situations. You know, it's often rushed, it's often, you know, often hastened because, you know, ICUs are under pressure. They need the beds, they need the staff, whereas, you know, in the comfort of their own home, it's a very different approach. It's a much more gentle approach. It's a holistic approach. It's a family-centered approach, you know, which I believe makes all the difference to someone's quality of end of life. You know, they're not shoved, patients in ICU are often shoved into a corner, or they're in a dark room, you know, whereas, you know, in someone's home, the home can be set up nicely for someone to pass away nicely at home, you know. And it's also a much better experience for the health professionals, for our nurses and for the doctors, because, you know, the reality is we've all been in end-of-life situations in intensive care that haven't gone well, you know. And because there's often so much pressure, you know, at home, it's at the client's pace, it's at the family's pace. You know, it's not at the ICU team's pace, it's at the family's pace, at the patient's, at the client's pace, which is very important. You know, people want choice, they want freedom, and they want to do what's right for them. And that's exactly what we can provide here at Intensive Care at Home. And again, we have saved the healthcare system probably hundreds of thousands of dollars by providing an intensive care bed in the home, rather than using an intensive care bed in a public or in a private hospital that costs $5,000 to $6,000 per bed day, you know. And we've kept that bed empty so that patients from the emergency departments, from the operating room, you know, can go into intensive care, you know. So it's a win-win altogether. And you know, it was as sad as it was to palliate this gentleman, it was a good experience for everyone, you know, because that's what the patient wanted, was their wish, and wishes need to be respected, especially since with intensive care at home, it provides a win-win situation for everyone, including the hospitals and the funding bodies, because otherwise they would have paid for an ICU bed, which would have been double the cost, right? So I hope that illustrates another case study for intensive care at home. If you are in a similar situation for palliative care, or, you know, if you have a loved one in intensive care ventilated with a tracheostomy, but also, as I've just explained today, BiPAP, CPAP, you know, but still needs, the loved one or you still need to be stuck in intensive care because you think there are no other options, think twice. There are options. You just contact us at intensivecareathome.com. We are currently operating all around Australia, but you should also contact us if you're in the US. We can help you in the US as well, but we're operating in Australia in all major capital cities, including regional and remote areas. We are a TAC, DVA and NDIS approved funding nursing service provider. We receive funding through those organizations. You should contact us if you're not sure how to go about funding. We can help you with all of that. Or if you're looking for home TPN solutions, you should contact us as well. At intensivecarehome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecarehome.com. Also, if you're a critical care nurse and you're looking for work, if you have a minimum of 2 years ICU, pediatric ICU experience, ideally with a critical care qualification, you should contact us as well. We currently have work in Melbourne, Sydney and Brisbane, but also in other major capital cities. Please contact us as well. And if you're an intensive care specialist watching this, you should contact us as well. We're trying to expand our medical team. And if you're an intensive care specialist watching this and you have long-term ventilated patients in your unit, please contact us as well. We can help you managing your exit blocks or bed blocks. Now, thank you for watching. Now, if you should also check out our membership for families in intensive care at intensivecaresupport.org. There you have access to me and my team, and we answer all questions intensive care and intensive care at home related in a membership area and via email. If you need a medical record review for your loved one in intensive care, or if you need an NDIS nursing assessment, you should contact us as well. We can help you with either. And subscribe to my YouTube channel for regular updates for families in intensive care and intensivecareathome.com. Share the video with your friends and families. Click the like button, click the notification bell, and comment below what you want to see next, what questions and insights you have, whether you agree with palliative care at home as opposed to intensive care. And I want to thank you for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care.